We are very fortunate today to have somebody who's been in the field of trauma, anxiety, depression, and addiction for decades now. He's a speaker, best-selling author, and a part-time associate, a professor at Harvard. And he's just released his latest book, which is Goodbye to Anxiety, Depression, Addiction, and PTSD, the life-changing science of dual brain psychology. So hang on, because we're in for a great conversation today that potentially could change your life as you love someone who's dealing with addiction. Welcome, Dr. Schiffer. So welcome to Thrive While Loving an Addict. We are very grateful to have with us today Dr. Fredric Schiffer out of Harvard. He has done some amazing work through the decades relative to trauma, addiction, and anxiety, depression, and PTSD. And so we're going to, mostly for our audience today, we're going to be talking about his story of origin, how he got into this work, but also we're going to talk about, how does somebody like me and our audience move it from crisis to struggling to surviving to thriving mode. And he has this book that came out in the fall that is going to be, I think, life-changing for a lot of people who are listening today. So, Dr. Schiffer, thank you so much for joining us. We are thrilled to have you with us.
My pleasure. Thank you. Thanks for inviting me. I'm happy to be here.
So if you would start with, your kind of origin story as to how did you get into this work?
Well, that's a good question. I come from a dysfunctional family, and I had a lot of psychiatric problems when I started college, and had a lot of treatment, and fortunately did well with it, and then went on to medical school, and I didn't have an intention of being a psychiatrist. I was studying cardiology, and I went to Harvard to become a cardiologist and did research on stress and heart disease. And I felt that I wanted more training in psychiatry for the stress part. And so I went to McLean Hospital, which is a Harvard hospital, to train and was going to become sort of a cardio psychiatrist. And the cardiologist didn't want anything to do with me.
Okay.
Nor did the cardiac patients. But I just loved psychiatry. And so it wasn't really that disappointing to me. So early on, started seeing at McLean. I was on the staff at McLean Hospital, and there were a lot of cocaine addicts who came into the hospital, and I was treating them. I got involved with that, and I wrote a paper about the treatment of them. What I found was that they were addicted not only to getting high, but also they were addicted to getting low. In other words, when they were coming off the cocaine, they were suffering and repeating their trauma. It was a sort of what we call a repetition compulsion, or a compulsion to repeat trauma. And so the pain of coming down from cocaine was actually addictive.
I'll be darned.
Yeah. And by treating that, people did very well. And so that was my first entry into addiction per se. And then over the years, it's been an important part of my practice. And separate from this, I came up with I was observing that patients, whatever problem they had, they seemed to have two different personalities. They would come in and they would be distressed, obviously, and symptomatic, but they also seemed to be immature and childlike. And then as they got better, they were more mature and stronger. And then something would happen and they'd regress and they go back to this other person. To me, it seemed like there were two different personalities. So I tried to, and in those days, McLean was a real bastion for kind of intellectual discussions and stuff. And no one was really that interested in my idea. And with my family, we were on a vacation in England, and I was rereading a book on the split brain studies, and they're very interesting. It's a surgery that was done for intractable epilepsy. They cut the connection between the left brain and the right brain. And then the brain, it sort of looks like a stem that connects the two halves. And what the surgery was, to try to keep the seizures from traveling over to the other side. And it was fairly effective as a treatment of epilepsy. But it won the Nobel Prize for the studies that they did of the people after the surgery. And what the surgery did was it created two minds. And so one person wanted to smoke, and his other hand would put the cigarettes out. Another woman wanted to wear a certain dress, and she's buttoning it, and her other hand is unbuttoning it. And sometimes one person his hands were fighting for different sandwiches in the refrigerator. And so I actually did a study at the last study on split brain patients in that series in California. And I did the first study of the personalities of the two halves. It turns out that the eyes are connected to the brain hemispheres such that a lateral visual field, say over here, if I show something over here like a hand, in a split brain patient, if the connection is cut, only the right brain will see it, that it travels just the way the eye retina is connected to the brain. There's a picture shown over here, the left brain, which can talk. So if someone has a stroke in their left brain, they can't speak. And whereas the right brain naturally can't speak in the vast majority of people. So the person would say, I can't see it. And so if you had an item, I don't have anything easy to sort of pick up here. Here's a camera battery. So if this is in a box, the left hand connected to the right brain that can't speak can easily pick out this item from a box. And so it can understand English, can follow commands, and it knows which item was shown to it. Roger Sperry, who won the Nobel Prize for this, showed a picture to the left visual field, which went to the right brain, and the woman started giggling. And so they asked her, why are you laughing? And she had no idea why she was really giggling. And what Sperry did was he showed in the 1960s a picture of a Playboy nude to the left visual field, and her right brain saw it and started giggling. And so we understood why she was giggling, and she understood. But her left brain was clueless. They're two separate people.
Right.
And so what I did was I put two words on the sides of the computer screen, and one side might say happy and the other dishonest. And there were these, and I would say, how much do you feel? And with their hands, they pointed to pegs. And one patient had a high opinion of himself in his right brain and a low opinion of himself in his left brain. And so initially I thought all of the trouble would be in the right brain. But it turns out that that's not the case. It's mixed. So you have to test the person to see which side feels more troubled. And another patient, when I was setting up the equipment, I was speaking with him. So I'm talking to his left brain. He told me he had been bullied as a child. And I know that that's a trauma from my practice. But he said it didn't bother him. It happened so long ago. But when I tested him, I put in some bully questions, and his left hand signing for his non-speaking right brain indicated he was extremely upset by the bullies. And we concluded that the trauma was active in his right brain, but not his left brain. So I then came up with a hypothesis that maybe the two hemispheres were housing these two separate minds in ordinary people. And I didn't have any way of really testing that. I was reading the literature and happened to come across almost by accident this German group of scientists who were purporting to show upsetting movies to one brain or another in normal people, and then getting different emotional responses. And I thought that was impossible because they have the corpus callosum, that stem between the hemispheres, is intact. So essentially, whatever you show to one side, you can get seen by the other side. But they were reporting that, no, they were seeing differences. And what they were doing was very complicated. I had to read it several times, and eventually what they were doing was they were tracking eye movements and masking a computer screen. And what they were doing was essentially showing the movie to one lateral visual field or the other. the same thing that the doctors had done and the same thing that I had done in my split brain study. So I figured, I could go like this and do the same thing. I'm blocking eye and half the other eye. And it actually stimulates the opposite brain. And so I didn't feel any differently. Years later, I did. And that's a whole different story.
Okay.
It was a very profound experience. But I looked out the two sides and didn't feel anything. And I went to the office that day, and I was treating a Vietnam veteran who was doing much better with his PTSD. He did have an alcohol problem that was actually resolved by this time. And so I asked him, I said, why don't you put your hands up and go like this? He looks out his right lateral visual field, which stimulates his left brain. And he got very upset. And he said, that plant behind you looks like the jungle. And I immediately, he was having a flashback.
Right.
And I said, well, look out the other side. And he relaxed and he smiled. He said, no, it's a nice looking plant. I'm in business.
Wow.
And I see that every day.
Wow. Wow.
And then what I saw with the people who were addicted to opioids was that on one side, they would have intense cravings, and might be 8 out of 10, might be kind of a common craving score. And outside, it would go way down, sometimes down to 0. And just by looking like this and then this, and response occurs in seconds. And other people respond to it as well, but it was very dramatic with the craving. And with the patient's permission, I had tape recordings of it. And it wasn't just the cravings. Like one patient, after I had discovered this, I made goggles that were taped in the middle. And now I use these special sunglasses that are lateralized. And we're getting trapped with the tariffs now. Well, we're having a problem. But people have put these on and they get the same kind of intense response as you do with your hands. And so I had a patient come back who had been treated for a cocaine addiction, and he had problems with his father. And he's looking at one side. And so it wasn't, I don't know that his cocaine feelings, they may have increased some, but what he was talking about was his discomfort when he looked at one side, and that he reminded him of his problems with his father. He thought his father was always demeaning and looking down at him. And then he looks out the other side and he feels well. And he's, I have a sadness from my relationship with my father. And if I looked at him out this side all the time, I could have repaired that relationship. I couldn't have used any drugs.
So question one is, obviously, in the space of, my belief is that there's nobody walking around that hasn't experienced some sort of trauma. So it's trauma, anxiety. We live in a world of anxiety right now, depression, addiction. So that's one piece. And I think as somebody who loves someone who is dealing with addiction or substance use disorder, we have our own traumas that go with that. And so there's the addiction side of people that are suffering. And then there's the loved one side of those of us who love someone who's suffering and our own experience. And so I'm super curious for our audience's sake, how this might have an impact in how we move from our own trauma and suffering to thriving in the midst of loving someone who's still in addiction mode.
Okay, well, this is really important. And first of all, I want to talk about the addict himself.
Okay.
So that there's the sense of, they've got a disease and they've got bad chemicals and bad genes and so. And what I always find is that they're suffering from trauma, and trauma is often apparent, and that people don't realize that they were traumatized. And it usually begins in childhood, and it might be bullying, or it could be a sibling rivalry. But then what happens is that it interferes with school performance. Teacher gets angry with them, and they get labeled, and then they get in with a bad group, and they have feelings of inadequacy, which then leads to usually alcoholism first, and then marijuana, and then other drugs, and that the addictions and all of these, being in the wrong group and not being a scholar, all of this leads to feelings of inadequacy, which is a profound trauma. And so being an addict is a trauma. And it's caused by trauma, but it is a trauma. And being someone who loves an addict, the parent, spouse, or whomever, it is extremely traumatic. It's wrenching. And in your talk, you describe that very well, and your courage in dealing with that. It also shows the pain that you were going through. And so the emotional trauma, the despair that addicts are suffering and that families are suffering is profound.
Yeah. We're totally in alignment here. And so what you've discovered and learned relative to dual brain psychology and the work that you're doing, how can that inform and influence people like myself who are loving someone, whether it's a sibling or a brother or a sister or a spouse, or in my case, most dramatically for me was my son?
Right. Well, I have several methods that I use in treating this. And the way I conceive of the problem is that I have to get to know and treat the troubled side. It's like a child in there, and that they're misperceiving themselves as a failure and is no good, and it's just their nature. And it's actually not true. It's that they experience some trauma and they are valuable people. And it's true that they haven't performed, but that doesn't make somebody valuable. Right? It needs to be clarified. And so I do what I call dual brain psychotherapy, where I'm talking to two people in one head. And so Steve Martin made a movie with Tomlin. And Lily Tomlin is in the movie in a meditation session, and there's a terrible accident with her guru. His humming bowl slipped out of his hands and tumbled down a large flight of stairs in Manhattan. As a result, Lily Tomlin's mind got embedded in Steve Martin's brain. And so it's called The Two of Us. Steve Martin wants to go uptown, and Lily Tomlin's screaming at him, and she wants to go downtown. And Martin is the embodiment, and he's trying to struggle between these two people in his head. And this is a lot like what really happens to people. So sometimes a person will wake up and they feel well and they're in control and cravings go down. And then other times something will happen and their cravings go way up. Now, with someone who's heavily into addiction, their troubled side is so dominant that they may not even know that they have a healthy side available. And that can be discovered for the first time. And it's very helpful to have an ally who's healthy.
Yeah.
That's what you did, I think. In other words, we were striving that you presented, instead of, fighting, between two people who were upset, you were strong and steady, and that people respond to that. And these two minds, even the immature side, can respond. And so I think that your courage and your steadiness and your striving was experienced by your son over time, and I think was an asset to him to help him calm down. That the troubled mind can also be stimulated by an insult or something that re-traumatizes him, or gets a call from his drug dealer, and it brings up all the things that he feels he's done wrong, and then he has to use. But both, like with the cocaine idea, that the addiction is both to repeat the trauma and to relieve the trauma. So it's really both sides of that. And so to stimulate the signs, I had these goggles, and I used, in my practice, I use the sunglasses, and I'll just flip them, and the person, I'll be talking to another person. And I'll say, do you remember what you saw on the other side? And they remember it, and so it's all in one mind. And if they feel well and they feel valued on their healthy side, that's really important, because if I tell them, hey, Joe, I really like you, and I think you're strong, and I think you're a good person, it doesn't mean much, because I'm getting paid. I could be a liar. I'm not, but I could be. But when it happens within your own head, and you feel valuable and you feel worthwhile. And then you look out the other side and you feel terrible about yourself, inferior and inadequate. It's really shocking, but you can't lie to yourself. And so that experience of feeling well is very, very valuable.
And can you stack the healthy side of your brain? Because I think for me personally, I live most of the time in the resilient side of who I am and the ability to rise and reframe and to still continue to stay in love and joy. And I have those moments, certainly. I think there's maybe a little bit of PTSD for me every once in a while. If I don't hear from Sam for like a few days or whatever, there's a little thing that pops up. It's like, well, maybe he's, relapsed again. And then I go into shifting mode. Does that make sense?
Well, yeah, well, let's try this lateral vision thing with you. It's very easy to do, and viewers can try it at home. You may get somewhat upset, but not more than you'll ordinarily be. You may feel better at the other side, but we'll see. I don't want to give you ideas and make it look like it's just a placebo effect.
Sure.
Because it's been tested at Harvard in placebo-controlled trials. And right now, we're just completing a $2.5 million study for fentanyl addiction, and we're getting remarkable results. I'm blind to the study, and I say we're getting great results because even though half the people are getting a placebo, and I'll talk about this study later, about a third of the subjects are coming off of fentanyl or really dramatically reducing their dose. So we're thinking that McLean and a startup company that people who are getting better are probably getting the active treatment, which I'll explain later. It's a light treatment, near infrared. But why don't we try? Do you have a card or something that we can?
Yeah, I have a piece of paper.
Okay, great. That's good.
Okay.
So I want you to cover one eye and the middle of the other eye.
Like that?
No, let me show you. I use my iPhone here. So I cover one eye and then move it over to cover half the other eye. Okay.
So
You
cover
got
one
that?
eye and go like that.
Yeah, that's right. So move it over a little more so it's half the eye. There you go. And it's important that you don't look out the whole eye because the whole eye goes to both hemispheres.
Okay.
And so when you do this, you're stimulating. So you're looking out your left eye, and so you're stimulating your right brain right now. And so if you think about maybe your son and his troubles and whether he's in trouble or not, or whatever you want to think about, something that might be somewhat stressful. And so tell me from 0 to 10, how much worry you feel.
Yeah, maybe 1 or 2.
Okay. Now I want you to look out the other side. So do the same thing. So block all of your left eye in the middle of your right eye. That's right. Okay. And what do you feel on this side?
I think I'm about the same.
Okay. Well, that's a problem with doing something live. But I think that if you try with your son, I think you'll feel a difference. And generally, people with more trauma will respond more. So, and in my practice, about 85% of the patients have a response. And actually, and even the 15% who don't respond usually eventually do respond.
So here's the caveat is I've done a tremendous amount of work through the years. So does that have any impact in what we just did?
Yeah.
Okay.
But I think if people at home want to try it, and if they have a way of communicating with you, they can let you know if they felt a difference, and maybe you can report that.
That'd be great. Yeah.
So measure like whatever they were feeling, that it could be anxiety or depression or whatever, from 0 to 10 on one side versus the other side, and whether there's a difference. Most people have at least a 2-point difference. And people who have a really strong response can have a 5-6 point difference.
Yeah. Well, I think, the statistics from a business perspective that, I'm paying attention to and I'm actually experiencing in my practice with executives is generally most people are walking around with some sort of anxiety. And some don't even know it. They're swimming in a sea of anxiety and they're unaware. They just think this is how it is.
Well, and what you might find, and again, you can test this, I think it's harmless. In fact, I think it actually leads to interesting discussions. In my book, they're fictional narratives of real sessions with patients, and they'll look out one side and have a discussion with them about what they're feeling and what those feelings remind them of. And then they look out the other side, it's a different discussion. And I try and get the two sides to help one another instead of fighting each other and trying to kill each other.
Right.
And it's very effective.
And can you get to the point with people where the only way that I think about it is they're kind of lined up?
Yeah, I think that the immature side remains more vulnerable, or, can be stimulated, but it becomes a good child. And so it's still somewhat immature. And if there's some insult floating around, it'll catch it and it's catching insults. And sometimes I'll wake up in the middle of the night and I have to go down and talk to Freddie. And at that time, now this works for me. And I get, in the middle of the night, I get go like this, and okay, I can handle this. But the other side, and I feel the anxiety. I'll say, well, I think it will be all right. And it calms him down. And he's an asset to me. So we work.
Right.
I do a lot of work on what's consciousness and what's the nature of life and how the memories work and so forth. And so I think he's very creative, and he helps me design studies and papers. And so we work together. Yeah. Whereas when I was in college and troubled, he was dominant. I didn't know his existence, but I know now that he had taken over and I couldn't function.
You're right. Right. Oh, so fascinating. So to actually be aware of what you're speaking about, kind of two sides to it, almost like the good side versus the troubled side, maybe.
Yeah, one side is really healthier, more reasonable. Now, he may be so pushed out that he's not apparent. And the troubled side, especially in someone who's actively using, that they've had so much trauma over years and that the healthy part of them really isn't there. Like in the picture of your son in your presentation, he was a different person. We didn't see a picture of him when he was using, but he was obviously a very healthy person who was happy. And when he began his journey, he probably was not aware of that healthy side of him.
Yes, and so I'm thinking about, because I for years have just thought that there's the addiction side of my son, and then there's the side of my son that I know to be true. And so these two sides of him, when he was in addiction mode, I was super fortunate. He didn't do anything to me. I mean, there wasn't anything along those lines. He would get mad because that side needed to get the next fix. But I was still always very steady with him, and the boundaries that I drew that were out of love. And I continued to deliver the message to him throughout the entire time that no matter what you do, you are always loved. And so how I'm thinking about this through the framework that you are talking about is I just kept speaking to my side that believes that. So I was kind of stacking that belief for myself, at the same time speaking to his side of really who he truly is.
Yeah.
Is that how you think about it?
You were trying to support Steve Martin, and saying, there's a good reason you go uptown and you talk to Lily Tomlin and say, now quiet down now. But, we'll, when we get the business taken care of, we'll take you for a ride downtown and you can go to the Village and listen to some jazz. But now I want you to be quiet now. Cooperate with us and stop fighting. This is the way I would talk to the two sides. And I think what you were doing was you were influencing his healthy mind.
Right.
And you did to the degree that he was able to develop his healthy mind. And then once it really takes hold, the person kind of realizes, hey, being healthy isn't bad. That I wasn't really having so much fun being tormented and suffering and causing other people torment and suffering.
Right. And so, he's coming up on 2 years clean and sober this weekend. And I think about some of the people that I've dealt with that are parents, particularly, who are so much in despair and hopelessness. And so it feels like the same thing is true with a parent that's in that space is to speak to their healthy part.
Absolutely. Yeah, that's a beautiful way to put it. We all have, I have my two sides, and I think there may be some people who don't have it. I haven't found a neurologist who's responded to this lateral visual thing that we just did with you.
Mm-hmm.
And I don't know whether there's something about neurologists that makes them unique, or they're balanced really well, or they have two healthy sides. I don't know, or whether they're more repressed on this side. But interestingly, in the fentanyl study that we're doing, we're not seeing huge lateral differences. And I think it's because of the fentanyl that, has gotten into their system, kind of mixes us up. We'll see a difference when we know which side to treat. It's not usually that, some people have like an intense craving on one side and not on the other. But with the active users, the technique is effective, but not as strong as it would be in someone who just comes in for trauma. And that may not be true, because the people who come into the fentanyl study are coming in off the street. And so they're a more traumatized population.
Yeah, and I remember I watched another interview that you had done, and it made so much sense to me. It's like we experience a trauma as a child, and then we keep getting re-traumatized based on how our behavior shows up, and we pick back, really the wrong crowd to hang out with, and then we get traumatized. In school, we get traumatized, and it just kind of keeps stacking to feed the belief that we are not worthy and not valuable, and so on and so forth. And so it gives, I guess, lens in which to view the notion that like who you surround yourself with is who you become, and that I know in Sam's own journey, because he in the last part was addicted to fentanyl also, there were things that he was doing that the healthy Sam would not even have conceived of. And so in the course of that, he was traumatizing himself. And so his traumas just kept stacking. And so, in so many ways, just the journey from like a decade of addiction to give your healthy side a fighting chance, so to speak. Wow, it's quite a courageous journey.
Yeah. And I think that all of the traumas seem to come down to feeling inadequate versus feeling worthwhile and confident. And that's really what the traumas ultimately come down to. And it's extremely painful to feel inadequate. It's a horrible feeling. And feeling healthy and feeling confident is well-being. It's a feeling of wellness. And it's hard to get from one to the other.
Yeah. Well, we're coming up on the end of our time together, but there's two things I'm super curious about. And if you would be open to continuing the conversation at a later date. One is, I don't know anybody who hasn't had trauma in some form or fashion growing up. I don't know how you are a human without experiencing some sort of trauma. And we're not talking, this is the challenge with trauma. When you say the word, people think of the really terrible, bad stuff.
Right.
And it doesn't have to be that. It just has to cut at your worthiness as a human being, your voice, your ability to stand in your own power. That's one piece. And then I would love to revisit with you on the other side once you've released the fentanyl study, because it's such at pandemic proportions and it's so vicious from its ability to kill us. It is a different ballgame completely than heroin or cocaine or.
Absolutely. Yeah. In fact, when we set up the study, we didn't know about fentanyl. And then we started the study and everybody was on fentanyl. It was all taking heroin anymore.
Yes. And partly because, and that's what happened with my son, was heroin got sucked off the market.
Yeah.
And then fentanyl was there. Yeah. And so that's what you had to access if you were in addiction mode.
Right. Yeah. It's terrible. What we do in the study, I'll just say quickly, is we have a special light that we developed at MGH, at the Wellman Center for Photomedicine. And I use it on one side. We determine with the visual thing, which is the positive hemisphere, and it stays the same rate in the person. And so when the person comes in, it's a 4-minute treatment with a special light device. And it's you can't, the ones on the internet that you buy, they don't have the right parameters. And so we have an FDA breakthrough designation with this. So if we're successful, we'll be able to bring it to market. And so with the light goes through the skull into the brain and stimulates it. Does a bunch of good things. But what it does most importantly is it stimulates the healthy mind.
Right.
And it does the same thing as this card that you have that didn't do anything for you.
Yeah.
But it does it more intensely and it lasts longer.
Yeah.
And so in a treatment setting, somebody would come in twice a week for treatments or have a home device.
Wow. Okay. So when does this study wrap up?
Well, I finished, we did 65 enrollees at my site. And then McLean Hospital is doing 65 at their site. And so far they've enrolled 57. So they have about 8 more to go to enroll. And then they have to study them for 6 months. So the new people, so they'll be finished in November.
Okay.
And I don't know whether the new struggle that Trump is having with Harvard cutting off all funding, whether that's going to interfere with this study. It might.
Okay.
Because the lab at McLean might have to shut down. And whether the FDA will accept our incomplete data or not, I don't know.
Okay. Well, what my experience with you and just having, looked at some of your interviews is that you are persistent, you are immensely curious, and you're doing work that truly matters and is life-changing. And so no matter what happens here, I can see that you're going to continue down this path for sure. And so if you would just hold up the book cover for our audience.
If you go to my website, it's dualbrainpsychology.com.
Right.
DUALBRAIN psychology. There's no punctuation. And you can learn more about we've got about 30 papers that we've published on experiments that we've done at Harvard in support of this. And they're high technology studies or clinical studies. So I hope your audience finds this helpful and useful.
I think you're just in the brain science part of leaning into and amplifying our healthy brain, our healthy side, and that we are actually more at agency to create our own thriving in the midst of whatever's going on. And I think not just as those of us who love people who are dealing with addiction, which is rampant, but also just in the world that we're living in right now that is so anxiety ridden and chaotic and disruptive and so on and so forth. I talk about this all the time with my execs, training up, skilling up to be the calm in the storm, because we are in the storm.
Right.
Yeah. And so I love your work in terms of how it's another way of looking at how our brains are working to help us be the calm in the storm.
Yeah. And I think it clarifies how the mind works. And it gives us some tools. In other words, there might be a time when you wake up and you're upset. Get your card out. In a session, if I have a virtual session with somebody, they get your equipment and they don't know what I'm talking about. And then eventually, they figure out that I'm asking them to get some junk mail.
Right.
So there's a good use for your electric bill now. And if people are distressed about something, they can kind of come down 1,000 or come down, a bit so they can handle it. And I do that a lot of nights. I'll come down and I'll I can deal with this. And then my perspective changes. People's body changes, they feel differently.
Yeah. Well, fascinating. Well, I just want to say how grateful I am for the work that you're doing and for you coming on our show today. And I look forward to having another conversation with you.
Thank you.
All right. Take care.
Right.